to assess the outcome of bypass surgery and endovascular therapy in patients with superficial femoral artery occlusive disease. Methodology and materials we use is actually observational analytical study conducted in Department of Vascular Surgery (NICVD). Patients included from July 2017 to June 2019. Number of patients 115 patients with SFA occlusive disease. Patients followed up by 1 year duration, that is from July 2019 to June 2020. Two groups were selected. Group A for bypass surgery, 70 patients were taken who underwent bypass surgery for SFA occlusive disease, and Group B for endovascular therapy, 45 patients who underwent EVT for femoral artery occlusive disease. Patients' inclusion and exclusion criteria. Inclusion criteria includes both sexes, patients above 18 years who were admitted to vascular surgery NICVD for SFA occlusive disease requiring surgical or endovascular interventions. Adequate aortoiliac inflow, adequate distal graftable vessels, adequate runoff vessels, at least single tibial vessel runoff. Exclusion criteria includes patients below 18 years of age, TUSC type A and type B, any non-atherosclerotic or acute limb-threatening ischemia, history of bleeding diathesis, patient with recent stroke, patients with pregnancy, and life expectancy less than 2 years to reasons other than peripheral arterial disease. That's the picture of bypass surgery and endovascular therapy. The results include demographic characteristics of the study subjects shows there is significant number in 51 to 60 years age group, that is 56.7% in Group A and 50% in Group B. The sex, male is predominant. Occupation, there are occupational distribution, actually farmers are more involved in PAD. The risk factors of the study subjects shows significant number of smokers involved in this disease process, and hypertension, dyslipidemia, and female history of positive coronary artery disease also includes. The clinical features of the study subjects showed patients presents with edema in 40% cases of bypass surgery and 45% cases in endovascular therapy patients. Ulcer shows 70%, while in EVT there are 60% patients present with ulcer and also gangrene with affected limbs. The postoperative findings suggest that there are required some interventions like ballooning, stenting, grafting, and endarterectomy. In endovascular therapy groups, there are 30% cases underwent ballooning, while 45% under stenting. And in case of graft, there is in Group A, there are 22% patients was done by bypass. According to the frequency distribution of the studied patients, according to the findings of arterial duplex after intervention, they showed after 12 months there was patency in Group A was 50%, rather in EVT group there are 65% patency. The AVI study is the AVI study of the study subject. There is a significant improvement in both groups. Complications in the study subjects. There were complications we include were wound infections, re-interventions, amputations, death, and no complications. 6.7% cases of bypass group was amputated, while in endovascular groups there are 10% cases found. Discussion. The debate between bypass surgery and endovascular therapy for superficial femoral artery occlusive disease, management is considering varied factors like patency, complications, and symptoms elevations. Our study comprising 50 patients, 30 in bypass surgery Group A and 20 in endovascular therapy Group B. aligns with previous findings, underscoring demographic similarities and common risk factors. Both interventions exhibited comparable improvement in mean ABI post-operatively, collaborating existing literature. Pregnancy rates over 1 year differed slightly between two groups, while complication rates showed no significant disparity. Notably, the need for reintervention was higher in endovascular therapy group. However, comparing these interventions directly was complex due to lesion severity discrepancy. Thus, while outcomes are comparable, lesion severity analysis warrant individualized treatment approaches. Limitation of the study, the sample size was small, the results could not be generalized, could not take large sample due to global pandemic time, that's COVID time. Long-term follow-up was not possible to take. Study population was selected from one center in Dhaka city, so might not represent wider populations. The study showed the outcomes were similar with bypass surgery and endovascular therapy in patients with superficial femoral artery osteoporosis. The study suggests bypass surgery is non-inferior to EPD in the treatment of vascular